was seeing Dr. Kilfoy in O'Fallon, she had noticed I had some gum recession and referred me here to Periodontics of O'Fallon. What Dr. Northcutt did was took some tissue on the roof of my mouth. They explained that they would have stitches that would dissolve on the roof of my mouth, and that they would transplant that skin onto my lower gum, and that those stitches would have to come out. And to be real honest, probably the hardest part was those stitches coming out 10 days later. I was a little skittish beforehand, but because Michelle and everybody, Dr. Northcutt, were very, very clear on instructions on what they would do, you know, and what to prepare for prior to me coming here, I was comfortable. They're very, very good with the insurance. I knew right up front prior to my procedure that I had the skin graft 6 weeks ago, that exactly what I would owe up front. I had oral sedation, which took about an hour before the procedure, which just made me kind of a little tranquil. And it kind of calms your nerves, the anxiety kind of goes away. It just makes you not so apprehensive. Then, to be real honest, the procedure didn't take that much time in my eyes. I was awake for it, but it was fine. The recovery was phenomenal. I was very impressed with everyone that treated me. Dr. Northcutt called me the day after my surgery to make sure I was okay, and even then proceeded to tell me if I was feeling fine now, it still might, here's some things you might expect in the next day or two, which did happen, and so I was very grateful for that phone call. I think my favorite part was just getting to know Michelle, getting to know Dr. Northcutt, coming in here. If I did have a bad day, you know, Michelle would listen to it, and just being able to come in here and feel like it was an atmosphere I was okay with. As far as, you know, dentistry goes, not everyone wants to go into the dentist's office, but I have never been apprehensive about coming here to see Michelle or Dr. Northcutt. And so it is really important. Don't be afraid to go to your periodontist or your dentist. It's really important to just go maintain your teeth like you would maintain your regular health.